Good evening. Welcome to Equality California's Power Hour on this week's Supreme Court ruling striking down Louisiana's restrictive abortion law and the fight ahead for reproductive freedom. We're also grateful to our partners at Planned Parenthood Affiliates of California and NARAL Pro-Choice California for co-hosting tonight's discussion. My name's Alice Kessler. I'm the legislative director here at Equality California, and my pronouns are she, her, and hers. For those of you who are participating in one of our events for the first time, we are the nation's largest LGBTQ plus civil rights organization with 900,000 members. And last year we celebrated our 20th anniversary. I live in Sacramento, where I lead our California state level advocacy. Our headquarters is in Los Angeles, and we also have staff in the Bay Area, Las Vegas, and Washington, D.C. Before we introduce the rest of our panel, it's my pleasure to introduce a very special guest that we have with us tonight, Congresswoman Judy Chu. Congresswoman Chu represents California's 27th congressional district, covering large portions of the San Gabriel Valley, and has served in Congress since 2009, where she sits on the House Ways and Means Committee and the Small Business Committee. She's the chair of the Congressional Asian Pacific American Caucus and serves as a vice chair of the Congressional LGBTQ plus Equality Caucus. In Congress, she has been a champion for LGBTQ plus equality and reproductive freedom. Among other achievements, she introduced the Women's Health Protection Act, the most supported pro-choice bill in Congress, which creates federal protections against state laws that impede access to safe legal abortion. She also serves as the chair of the Contraception and Family Planning Task Force of the Pro-Choice Caucus. Prior to her service in Congress, Rep. Chu was a member of the California Board of Equalization and the California State Assembly. And while in the Assembly, she authored legislation to expand LGBTQ plus civil rights in partnership with Equality California. So Congresswoman, thank you so much for joining us this evening.
Well, greetings from Washington, D.C. It is so wonderful to be with Equality California and Planned Parenthood California for what has been an incredibly exciting week. I know I'm not alone when I say that following the confirmation of Brett Kavanaugh to the Supreme Court, I was prepared for the worst in the June medical decision, but instead I was overjoyed when the Supreme Court struck down Louisiana's unconstitutional anti-choice laws. Monday's ruling was a huge victory, but a closer look at the ruling shows that the battle is not yet won. Roe versus Wade and a woman's right to choose are still in danger. Chief Justice John Roberts was the fifth vote in striking down Louisiana's laws, but only, he said, because this case was nearly identical to one that they ruled on 4 years earlier. In that case, Whole Woman's Health versus Hellerstedt, the court rightly ruled that restrictions on a woman's ability to access abortion care, like unnecessary hospital admitting privileges for abortion providers, are an undue violation of her rights. In his opinion, in June Medical, Roberts essentially said he did not agree with the ruling in Whole Woman's Health, but he was compelled to uphold precedent. In other words, he could have said, come back with a different case and we may be able to strike down Roe. And this challenge is absolutely coming as Republican state legislatures continue to look for new ways to chip away at women's reproductive rights. If they cannot completely ban abortions, then they will try to make abortions impossible to access. And this is happening right now. Currently, there are hundreds of cases in the pipeline that involve curbing access to abortion. And it's likely one of these could come before the Supreme Court in the near future. For example, there's a case from Texas challenging a state requirement of burial or cremation of fetal tissue, and a case from Arkansas challenging a state prohibition on D&E procedures, the safest and most common abortion procedure in the second trimester. There are cases challenging state laws on unnecessary waiting periods, cases fighting back against attempts to defund abortion providers like Planned Parenthood, and that question the constitutionality of requirements for ultrasounds before a woman receives an abortion. And new state laws that put onerous and medically unnecessary restrictions on abortion access are continuing to pop up, with over 450 such laws passed since 2011. So it's clear that the issue is not going away. Then there are also the more comprehensive abortion bans from Ohio, Kentucky, Utah, Georgia, and Alabama, all making their way through the courts. These bans either completely ban abortion outright or put arbitrary restrictions that prohibit abortions after just 6 weeks, before many women even know that they are pregnant. Anti-choice extremists are pushing the limits of what the courts will deem acceptable. So even if Roe versus Wade is never overturned, they will make sure that the right to an abortion has been eroded in so many states that abortion is effectively out of reach for most American women. That's why it is not enough to wait for the court to affirm or deny our rights. Instead, we must take action to enshrine our rights in law so that they are guaranteed for everyone. And that is why we need my bill, HR 2975, the Women's Health Protection Act, which would put a stop to these state-based attacks and basically enshrine the protections of Roe versus Wade into law by ensuring that providers have the right to provide and patients have the right to receive abortion care free of medically unnecessary restrictions. The Women's Health Protection Act will ensure that no matter where someone lives, no matter their zip code, abortion access is a right for all. The good news, this bill is popular. With 216 co-sponsors of members of Congress, this is the most co-sponsored pro-choice bill in Congress. And by the way, this is in the most pro-choice Congress in history. Yes, we have the most members of Congress that are outwardly pro-choice than ever before. And we've already had a hearing on it in the Energy and Commerce Committee, which is a necessary step to bring it to the floor. But Monday's decision makes it clear we can't risk waiting. Another challenge to Roe is coming, and we cannot guarantee the same result. So instead, it's time we take matters into our own hands, pass the Women's Health Protection Act, and protect our rights once and for all. This is our moment, and with your help, we can get it done. Thank you all very much.
Wonderful. Thank you again, Congresswoman Chu. I know you have to go, but we're so grateful that you're able to join us and for all of your great work in Washington, D.C. If you're just tuning in to the Power Hour, we are talking about June medical services. This past Monday, the Supreme Court's 5-4 decision in this case confirmed that what we in California already knew: abortion is a fundamental right. But while the decision is a victory for Louisianans, for far too many people, access to abortion, as the Congresswoman noted, still remains a right on paper only. Thank you for joining us today as we discuss what the ruling means with some great speakers and what's next for abortion access in the country and in California. So I'd like to introduce the panelists who've joined us today. First, we have Candace Bond-Theriot, who is a Senior Policy Counsel for Reproductive Rights, Health, and Justice, and the Democracy Project Director at the National LGBTQ Task Force, a national organization that advances full freedom, justice, and equality for LGBTQ people. We also have Shannon Hovis, who is the Director of NARAL Pro-Choice California, the grassroots pro-choice advocacy organization working to protect every woman's right to access the full range of reproductive health options. And lastly, we have Jody Hicks, who is the president and CEO of Planned Parenthood Affiliates of California, the statewide public affairs and public policy office representing the 7 Planned Parenthood affiliates and over 100 health centers throughout California. As is the case with abortion access to the full range of sexual and reproductive health care and comprehensive sex education has traditionally been out of reach for people with low incomes, people of color, young people, LGBTQ people, immigrant communities, and rural communities. And so today we're here to talk about what the June Medical Services decision means and what's next, because we know that even today, following a victorious ruling, your ability to access abortion still is determined by where you live and how much money you make. And in this country, that effectively also means the color of your skin. So I'd like to start out directing a question to Candace. Candace, as our legal eagle on the call, I was hoping you could go into a bit of detail about what the case means and what the court decisions relating to healthcare access in general, like the LGBTQ decision on Title VII, mean for Americans.
Yeah, of course. Thank you for having me. My pronouns are she and her pronouns. And I love the legal eagle reference because I'm actually a legal eagle twice from North Carolina Central University School of Law. We are the Eagles. And then I did my LLM at American University, and we are the Eagles. So I really am a legal eagle through and through. So as the Congresswoman said, Monday's decision was a bit of a surprise for me, as someone who has been adamantly and vehemently and will continually fight against a lot of the Gorsuch and Kavanaugh rulings and their, positions even on the Supreme Court as of now. So it was a shocking, surprising decision. And what's really important about it is that it doesn't actually move us a ton forward. It's really just holding the line on where we already are. So as the Congresswoman said, it was a 5-4 decision, which means it's, as close as possible. And a lot of our cases are 5-4 decisions, with the 4 progressive justices and Supreme Court Justice John Roberts, Chief Justice, siding with the progressives this time on the court, and basically invalidating the law, saying that Louisiana Law Act 602 is just completely unconstitutional, based on the recent precedent of Whole Woman's Health, but also on earlier precedent of Planned Parenthood versus Casey. And what's really important to note is that Chief Justice Roberts really was looking at this precedent and looking at the doctrine of stare decisis, that this decision has already been heard and decided by the court, especially upheld again in Whole Woman's Health, and that this is not a particular issue that the court needs to even really hear again. And he still does not agree with the merits of the case. And he would have upheld the law if there would have been a different decision in Whole Women's Health, which is really important and really telling for how much we still have to fight and how much we still have to work to really ensure that abortion access is actually accessible for folks in this country, particularly Black and brown folks, particularly queer and trans people of color and low-income folks, who abortion has never really been accessible. And this is a great moment to sit back and celebrate. We've been through a lot this year, 2020, and no one could have envisioned all of the things we've gone through. And so this is a moment that I'm definitely going to take and celebrate. And it's holding the line. So we're celebrating the fact that we did not move backwards, but we also didn't move forward. So we still have a lot of work to do. And I'm going to take this, weekend, this holiday weekend, and live in my celebration and live in my victory. But it was a really important decision for us.
Wonderful. Thank you, Candace. That's I've been spending most of my day getting ready for this tonight and reading about the case, and you basically encapsulated everything that I've read so beautifully. So thank you. And we'll have more questions for you as we move forward. But I'd like to pivot next to Shannon Hovis with NARAL. So Shannon, the restriction struck down by the Supreme Court is one of over 400 types of restrictions introduced by states in the past year. So I was hoping you could provide us with a bit of background on what the different types of abortion restrictions that have gripped the country in the past years, and a little bit of a landscape there.
Yeah, absolutely. Thanks, Alice. Nice to see you, and thanks for having me. So I guess to piggyback off of what Candace was saying, I mean, what we should see is that Chief John Roberts, his opinion was purely based on precedent. He was saying, look, the court decided this 4 years ago. he knows that he would demolish the integrity of the court if he ruled differently in this case just 4 years later. But as she says, he's not an ally of ours. He does not agree with us. He's not in our corner. And he basically left the door wide open for the hundreds of others, as you say, medically unnecessary restrictions and laws that are on the books across this country. So that includes things like mandatory counseling, mandatory waiting periods, mandatory biased counseling, counseling even on information that has no medical basis at all, like about abortion reversal, which is not a thing, it's not real. Things like parental notification and consent, really being sure that they are trying to insert as many barriers for young people to access care. So actually just yesterday, I believe it was, Florida's governor signed, it might have been today, Florida's governor signed a law expanding their parental notification law and actually requiring parental consent for minors to access abortion care. So we see things like that. The fetal tissue laws, even that Representative Chu was talking about earlier, how do they make it so incredibly challenging for both patients and providers to both access and provide this care? And so that is where we see one of the two strategies that the anti-choice extremists and politicians are pushing, which is the chipping away strategy. They're looking at how do we so seriously undermine access to legal abortion by just making it almost impossible to get. Like if there's one abortion clinic in your entire state and you have to go for 2 separate appointments 3 days apart, you have to take that time off work. It's hard to get scheduled in the first place. You have to get the funds together to travel there. Like they will make it as hard as possible. The other side of this, though, is the abortion bans, which we've also seen in droves, right? So, and that's still happening. Even just this week, there was an abortion ban happening in Tennessee, where they passed a 6-week ban. It actually has a whole cascade of bans in addition to a bunch of other restrictions as well. And last year alone, 31 states introduced, passed, or signed some form of an abortion ban. So these are all things that are working to bait this Kavanaugh court. We saw Kavanaugh's true colors this week. We know where he stands. It's part of the reason we're going after Susan Collins as hard as we are come November. But yeah, I mean, there's just an abundance of different ways in which they are trying to attack our access and our rights at every angle.
Thank you, Shannon. That's super helpful in kind of setting the table here. So I think we're I'd like to kind of bring some more flavor to this discussion about, we know that this court decision brings a lot of attention to abortion rights, but as we've already identified in this conversation, abortion access is equally, if not more important, to make those rights meaningful. And so, Jody, I'd love to hear your thoughts on this for patients, both nationally and in California.
Thank you, Alice, and thank you for having me today. And you're right. It's the difference between reproductive rights and reproductive justice, right? So, the frustrating part, I think, for all of us here today is this was decided in 1973. We've decided that this is a constitutional right that women have, and what we want to be working on is we know that there are institutional barriers that exist in our healthcare system for anyone trying to access healthcare, especially women of color, and especially reproductive healthcare in general. That's what we want to be working on. So as Candace pointed out, we spent all of this time fighting a law today to just stay in the status quo and not be harmed, to not have women harmed. And it's really frustrating. I mean, I celebrate for the women in Louisiana, because if this had passed, there's 850,000 women of reproductive age in Louisiana. They only have, I think they had 11 health centers, within the last decade. Now they're down to 3. This would have put them down to 1 with 1 healthcare provider, not including the bordering states that also have barriers to care, that are traveling to New Orleans to try and get care. And that 1 health center would not have been able to serve, even if they wanted to, all of those patients, and certainly the states around them. So, I mean, even with our constitutional right that is in every state in this country, we still have states that cannot provide that care, and it's frustrating to say the least. And I think what we want to be, as we're having a national conversation on racial justice, part of that is racism that exists in our institutional systems, including healthcare. We want to be working on those barriers, and we're just, having to continue to fight these. And I think COVID and this pandemic has borne out. We've seen what those effects are and how communities of color are disproportionately affected. But then on top of that, we have 11 states who have also put up barriers and blocked access to abortion by saying it's not an essential service. So at our health centers alone, and this is not including the independent health centers throughout the country, but just in Planned Parenthood health centers, one of our affiliates in Southern California, since the pandemic, since March, has already seen 200 patients from out of state. That's heartbreaking that in a pandemic, people are risking not just everything, the travel and all of the things that they have to do to try and seek care, but in the midst of a pandemic. And, CNN did a really great photojournalism story tracking a young woman, 22, from Texas to California just to try and receive an abortion. And, it's access to care is already an issue. And the fact that in the middle of a pandemic, we're putting more barriers to abortion, which is an essential healthcare. It is part of our rights. It is part of our birth control and everything else that women need. And it's something that we're having to define and talk about in the middle of a healthcare crisis. It just continues to be frustrating. I mean, I think we're all grateful to be in California, where we do prioritize and value reproductive health. But, how we make laws, how we budget, how we do all the things we do still affect how women get care. And even in California, there are deserts where women have to travel a distance. And then, we haven't even talked about the Hyde Amendment, which is yet another layer where women that are on Medicaid then can't afford to get it because we don't get federal monies that will help pay for that. Here in California, we do, but that's not true in other states. It's another reason why we tend to see patients from out of state come across the border. Mm-hmm. But thank you for the question.
Thank you for the answer.
And we're celebrating, but it is frustrating. Celebrating the women in Louisiana today.
It's a complex picture for sure. I did. So first of all, I'm for anyone who's joining us now, because people are popping in and out of this Power Hour. We're here with Equality California, Planned Parenthood, affiliates of California, NARAL, Pro-Choice California, and the National LGBTQ Task Force. We're talking about the June medical decision that came down from the Supreme Court on Monday. And I would encourage anyone who's joining us, submit your questions. Please join us in this conversation. We'd love to hear from you and have our great panelists address anything that's on your mind. And while we're waiting for those to come in, I do have some additional questions. And Candace, I'd like to pop back over to you. So Equality California and most LGBTQ plus organizations are pretty full-throated in their support for abortion access. Beyond the fact that LGBTQ plus people seek abortion care and often rely on clinics like Planned Parenthood for care, why are reproductive freedom and LGBTQ plus civil rights so inextricably linked? I'd love for you to explore that question a bit.
Yeah, I mean, for me, as a queer, Black, bisexual woman, it's like in my body, so it feels really obvious to me that, of course, they're linked. And, for folks who may not be their lived experience, it's all about bodily autonomy, right? It's all about the ability to determine if, when, and how to pregnant or not to pregnant or not, and not to parent. And I think that this moment that we're in this 2020 world of COVID and the resurgence of the Black Lives Matter movement, to me, shows how even more intersectional and linked we are. and how reproductive justice, names the intersections and names the intersections of police brutality and how that's related to healthcare, and how, being just Black in this country is a public health issue, right? Like racism is a public health issue. Social determinants of health are not just something that, we say in academic and policy world. It has a real impact. It's not a theoretical thing, right? And I think in this moment, people are starting to like put the pieces together of being like, oh yeah, like this is the same community that's being affected by COVID. Oh, this is the same people in Louisiana who can't access abortion. Oh, this is the same people who, luckily now because of the Supreme Court last week, if they're out and LGBTQ at their jobs, are able to keep their jobs. It's the same people. And I am a Virginian and living in Virginia, so I am not as lucky as you are to be in California land. So it's a lot different here. There's just so many layers of all of the things that we're experiencing, and I think reproductive justice does a great job of explaining those intersections and those connections in ways that other frameworks aren't able to. And it's also really important to note that reproductive justice makes a pathway for LGBTQ inclusion and centering of queer and trans people, and centering of young people, and undocumented people and poor people. If there's an actual, framework that allows us to center our life experiences, and there's a way to do reproductive justice work and work on reproductive health and reproductive rights through a justice lens. And I think we're moving to a place where I think folks are starting to recognize that. Like even talking around the two medical services decision, even within the internal politics of the reproductive health rights and justice movement, it's been a different conversation than whole women's health. There's been an intentional centering of people of color. There's been an intentional centering of young people, of marginalized people, of thinking about, we're also getting the DACA decision, we're also going to get a decision on LGBTQ health, that we weren't in this place 4 years ago. And that is one of the things that I'm celebrating, is celebrating the movement that we've actually made within the movement that may not be even noticeable to folks outside of the movement and outside of the work, but there is a shift happening, and that is what I'm really living into and feeling proud of.
Thanks, Candace. That's super insightful. And at Equality California, it's been amazing to me. Since our inception, basically, we really have partnered very closely with on reproductive justice issues, and fighting ballot measures that were attacking reproductive choice, and also having our partners in the reproductive justice movement join by our side when we had ballot measures attacking LGBTQ rights. But it's been interesting, even in some of our more recent work, where we've been trying to expand access to PrEP and PEP, HIV preventative medications. A lot of times we talk about, draw a comparison to birth control. And, I think it does really come back to this idea of personal autonomy. And especially in some of these cases, the way that the court is looking at those issues, they really are bound very closely together. So, we have a very vested interest in all of these cases. Yeah, Jody, go ahead.
Can I jump in? I mean,
Please.
I love this question because, and Alice, we've worked together for many, many years on many of these issues, and I'm so grateful for that. But I think it is about bodily autonomy. And then further than that, it's really just about, there was a study that was done because there's this argument all the time about women that have abortion, that they have, mental health issues or regrets and things. And the truth is, there was a study that was done that 95% of the time they not only know that their decision was the right one, but they were better because they were able to make a more informed decision later on. And so it's really about safety. It's about dignity. It's about justice. It's about your right to pursue your destiny in the way that you want to live and the life that you want to have. And that's what is so intersectional about some of the other issues and civil rights issues that we all need to be in the fight for together, because that's really what it's about. It's about your right to do what's best for you and have the life that you should, and have the dignity and have the right to lead. And end of story.
Yeah, I love
Yeah.
that. Go ahead, Shannon.
Well, I mean, I'm a bisexual woman too, and like very proudly bi-feminist in this space. And I definitely, yes, I just feel so much pride in the intersectional work that we do, because the reality is that when they're coming for one of us, they're coming for all of us. Like that is the reality of the ecosystem in which we live. And I like to add, like when we talk about reproductive freedom, reproductive justice, it's sexual and reproductive. When we work on those, like when I started out in this work, when I was in high school at the Marin AIDS Project as a peer health educator, like we were doing sexual and reproductive health. That is PrEP, that is PEP, that is getting gender affirming care and getting the hormonal treatments you need. Like that is all of that. And so to me, the intersections are so, so close. And, you know, I mean, I think about things like we're fighting Catholic healthcare, expansion of Catholic healthcare, solely because Catholic healthcare, by and large, refuses, they categorically deny people basic reproductive healthcare and gender affirming care. It is women and LGBTQ people who are discriminated against. And so we have to get together in alignment to fight these issues, because otherwise we can't, I mean, we're not big enough, and our tent is not big enough to really fight these battles and win. Yeah.
Thank you all for your comments on that question. I think, you know, part of what we try to do with these power hours is educate, you know, our audience and help them understand why we work so closely together. So really appreciate that. I did want to just talk a little bit about kind of the landscape of abortion rights across the country. California and 12 other states and the District of Columbia have laws that protect the right to abortion, but 9 states have so-called trigger laws. And I'd love for any one of you jump in to talk about what those are and why they are so dangerous.
Well, I can start and then others can jump in if that makes the most sense. So a trigger ban basically means that if Roe v. Wade falls, then abortion will be banned in that state. And so we are talking about, there are a handful of states that have pre-Roe bans on the books. Abortion was illegal in this country. Actually, the long history of this is abortion was not illegal. Then it became illegal for a very brief period of time. And then it started to be not illegal again. And now we're going back to it being illegal almost in a lot of places in a lot of ways. So pre-Roe bans means abortion criminalized on the books. Roe v. Wade came through and basically nullified that law. But in many cases, those laws remained on the books across this country. There are other states, or sometimes the same states, that have also passed these trigger bans, where essentially they say, look, we understand Roe v. Wade is the law of the land right now, but if or when the Supreme Court overturns it, abortion will immediately be banned in this state. And so they are preparing for that moment in time. It's actually why it adds urgency to what we do in California, what we're doing electorally across this country to try to claw back state legislatures, claw back state governorships. We have to get back these states because already we have a patchwork quilt of access. And like Illinois is really the only state that is really currently providing kind of an island of access in the Midwest. California, we're lucky on the western board, but we have people, as Jody alluded to earlier, traveling from Texas, Louisiana. People travel from all over to come here to get care. So it really drives home the imperative of us actually meeting a gold standard of what reproductive freedom and justice look like. And frankly, we're not even there yet. We are still aspiring in that fashion.
Candace or Jody, did you want to touch on that?
Yeah, piggybacking on that, Thank you, Shannon. I mean, I think it again goes back to, tying things back to access to care. And anytime you have these kind of laws on, it's confusing. It's confusing for us sitting in this room that well, virtually in the room, that actually work on this issue. It's confusing to know when things are legal and when it isn't legal, when it's going to be paid for and when it isn't. Does your health insurance, is it going to tell your partner or your parents what's happening? Is it confidential? Is it, all of those things are confusing. And so when you have these things like trigger laws, it just, the point is to further sort of intimidate and confuse and have any kind of layer of barrier to access to care, which is the goal for some of these anti-choice lawmakers, unfortunately. And it is why we see so many patients from out of state. Oftentimes it's not that they can't get the services there, they just don't know how to navigate it. And California has sort of been the beacon of we will be confidential, we will have ways to pay for it, we will help you with travel. And that's not true in every other state. So I think a lot of these laws are just meant to sort of confuse and intimidate women.
Mm-hmm. Yeah. So my next question, and again, if you're joining us, we're talking about the June medical services decision with Planned Parenthood, NARAL, and the National LGBTQ Task Force. If you have questions about the topic, please do ask online. We would love to engage you in the conversation. We had Congresswoman Judy Chu joining us earlier, and she mentioned her bill in Congress, the Protect Women's Health Act. I'd like to, she kind of made some references to it, but didn't get to unpack too much of that. I'd love to hear your perspectives on why that legislation is important, and maybe some thoughts on the whether it might pass or not pass, and kind of what that picture looks like in Congress. Candace, you're in Virginia, so you're very close to Capitol Hill. So I might ask to start with you.
Yeah. So at the National LGBTQ Task Force, we work on this bill, but our bigger bill that we work on as an organization is the Each Woman Act, which is kind of, we've been saying it's like the opposite side of the same coin. Is that the same? It comes together, right? So for the Each Woman Act, it's really about focusing on making sure that people actually have access to abortion services through Medicaid and through the CHIP program. And that is, for us at the task force, that is of the utmost importance, because that's like step one of making sure your insurance covers it. And then the next step for us is the Women's Health Protection
Act. Shannon or Jody, do you want to comment on that at all? If not, actually, I would love to ask, because I know both of you are in California, but I'd love to ask, obviously, COVID-19 was very disruptive to our legislative session here, but if you wanted to share anything about sort of some of the priorities we have in California, that would be great too.
So I'll start. I will say something about the Women's Health Protection Act, just because I think we're talking about basically what a lot of states have already done. California has done through our Reproductive Privacy Act. We've put into our state laws the protections of Roe v. Wade. So essentially to say the state government cannot interfere with an individual person's personal decision about pregnancy up until viability, period. Now, is this going to move anywhere? Obviously, in this current political environment, absolutely not. Getting through the House, okay, maybe should get through the House. We have the first pro-choice majority House ever. Current Senate, of course, not, and the presidency, of course, not. We have to think about this in the opposite too, which is the currently very frightening part, which is we have an anti-choice majority on the Supreme Court. We have an extreme anti-choice and terrifying monster in the Oval Office, and we have an anti-choice Senate. So if we actually were to lose the House, we could have them pass federal legislation to mandate a nationwide ban on abortion. And the Supreme Court could uphold that. Now, that is the nightmare scenario for all of us, because then people who live in California and say, but I live in California, everything should be fine. Nope. Also would undo everything that we've done here to enshrine people's at least legal right to abortion care. So that's sort of, the framework for this. And of course, I mean, the magic here would be if we are actually able to flip the Senate, flip the presidency, do the work we need to do on the electoral front so that we could pass legislation like this and force the Supreme Court to actually take this kind of thing up as federal legislation. And then after Jody talks about California, I'm happy to talk about California.
Okay, yeah, that'd be great.
Sure, I'm happy to. Thank you, Shannon. I mean, I think, we are lucky in California. That doesn't mean we don't spend resources trying to help the rest of the nation or having to work on those issues too. And if we can get something like Congresswoman Chu's bill to pass, where we can put this issue to bed once and for all, that would get us back to doing the work that we want and need to do, which is ensuring that women actually have access to care. So, I mean, that is the goal. Whether or not that can be done in the short term, I don't know, but it's a lofty goal worth fighting for, right? So, we have all of our partners working on those issues. I think for priorities here in California, obviously, COVID, threw a wrench in what everybody is working on. We did a lot of work. I mean, the good news is I think we truncated a lot of strategies that we had that were maybe a year and 2 years out in terms of telehealth and how we direct services to patients. And we managed to have it all happen in 2 weeks. So that was amazing. Crisis can sort of force things like that. So we quickly at our health centers were serving patients through telephonic communications and then doing things like touchless birth control pickup stations where people were literally driving up and people were taking them out and putting prescriptions on top of their car. So there's a lot of innovation that happened in a very short period of time to ensure that women were still receiving timely care. But I will say, even in California, and again, we're always grateful that in this state, our lawmakers value reproductive health services, but it wasn't, there wasn't a time during the first month that I wasn't on the phone with someone from the county, or, there was a definition of what was essential health care, and reproductive health, women's services and pregnancy related services were a part of that, but still explaining that abortion is not elective and that it's not something that can wait 6 weeks when the next shipment of masks come in. Our health workers still needed that equipment. So, even within California, there's a lack of understanding, I think, of what is needed for those services, and certainly the timeliness of them. We didn't, despite COVID, we didn't see a lack of protesters and security issues at our health centers. That still remained an issue, amazingly. That didn't slow down. And as a matter of fact, we had an uptick in vandalism and things like that. So those remain a priority for us. But I think overall in California, 1 in 3 patients is on Medicaid. Our health centers serve some 85% of Medicaid. I think this topic of racial justice has also been something that has forced a different lens in how we look at things. Budgeting is certainly a statement of values, and I think another look at how we make decisions that disproportionately affect communities is really important. And I think that's a lens that we're all starting to look through, but it certainly is true for us and our health centers and the patients that we serve, and what all of those things mean anytime that there's, again, if everything from how we get providers, we all know that there's a provider shortage, but, if we're not helping people from certain communities actually get into medical school or get into nursing schools, then we know they're less likely to go back and serve in those communities. And so really, I think ripping off the layer of every way that we've looked at how we do healthcare delivery in California, we need to look at differently. And I think there's a willingness to do that. We just have to keep it moving forward. And that's going to be a priority that we work on this next year.
Great.
Yeah, I guess just what I would add is, so California is very imperfect. We still have incredible access deserts. 40% of our counties do not have a single abortion clinic. Nine of our counties don't have an OBGYN. Another 19 counties have fewer than 5 OBGYNs. We have massive maternity deserts and abortion care deserts. People have to travel in this state sometimes up to 180 miles to get to the nearest abortion provider. I mean, we're a big state, but still there's a lot of work to be done as it relates to geography, rural communities, access, and definitely equity. I mean, we like to throw shade at a state like Louisiana for what it's doing. Black women in Louisiana are 4 times more likely to die from a pregnancy-related death than white women. But the same rate is true in California. Black women here are 3 to 4 times more likely to die in a pregnancy-related death than almost everybody else, except for Indigenous women here who also have rates like that. So what are we doing to actually meaningfully close the gap? It's why NARAL is involved. Last year, we ran a bill with Black Women for Wellness and others to require implicit bias training for perinatal providers, because bias is one of the evidence-based, it is proven that bias is a real factor in contributing to these disparate outcomes. And this year, we are working to remove a medically unnecessary restriction that still exists in California, which is that we still have physician supervision for nurse midwives. We are one of only 4 states in the entire country that still has physician supervision for nurse midwives. And so, I mean, we're keeping the company of Nebraska, Florida, and North Carolina, not typically the company that we keep as it relates to reproductive freedom and healthcare. And so we are looking to remove that, build in a more team-based model, which is what ACOG and others across the country support in any case as the most appropriate medical model. And one of the important reasons that this matters is because it's been identified by leading health organizations like the World Health Organization as one of the most important strategies to use to reduce these kinds of disparities that exist, especially for Black women. So I just think that as it relates to this state, we do pride ourselves. I do think we are innovative in certain ways. There are areas where we have a lot of work and we have to stare ourselves down and be real honest about where we are at and where we're at relative to other places, because we're not necessarily doing a ton better.
Mm-hmm. Yep, great. Well, I think we have time for one more question. I don't think we've gotten any audience questions, which is their loss, frankly, because I'm loving this discussion. But I wanted to just touch on some of the important work that your organizations do with respect to reproductive freedom. The Supreme Court's ruling in Hobby Lobby allowed privately held companies to refuse to cover insurance reimbursement for contraception. So beyond abortion access, are there birth control or other reproductive freedom cases working their way up to the Supreme Court that folks should be aware of?
There is a birth control case right now that we are waiting on. So Pennsylvania versus Trump, and this is basically another attempt by this Trump administration to expand into the sort of moral or religious objection space, where regardless of your employer, if they have any moral objection to your use of contraception, they could basically intervene so that your insurance will not cover that birth control. It is extraordinarily wide as far as who that could intervene and object in this fashion. And the anticipated impact is hundreds of thousands of additional women and people who need contraception being out of that because their employer objects in this way. We expect that ruling will come down as soon as, could be tomorrow, could be the beginning of next week.
Well, we will all be watching closely. We've certainly had some good decisions come down that we weren't expecting, and hopefully we'll continue that trend. But as you all mentioned in this conversation, there's certainly a lot of work for us all to do together to ensure that all of us in our communities do have that ability to live our authentic lives and to have self-determination. And so I just want to, on behalf of Equality California, thank each of you and your organizations for being fabulous partners to us. We never do feel that we're alone in the moments when it matters the most, because we have partners like you. And I did just want to give kind of in wrapping up here, each of you an opportunity to just tell us where people can get more information about your organizations, any ways they can get involved, or any other information you'd like them to have. So Jody, why don't you go ahead first, and then we'll move around the clockwise.
Sure. I'm going to look because somebody wrote it down for me so I don't get it wrong. So, I mean, first, for our national, there's a text. You can text enough. It's 22422 to stay updated on information. It's a mobile action network. But then there's also the independent clinics that were involved in the June medical. There's keepourclinics.org, which you can help with the independent medical clinics. Obviously, there's, if people do need services and it does get confusing, there's Abortion Finder, where you can actually, you can find a provider, or certainly go on Planned Parenthood website to find services or any help that you need. But thank you for all of this. And I think, looking forward, and certainly if you text these and continue to get information, we're not seeing the end of the assaults and the continued efforts to try and chip away at access to abortion. Unfortunately, what's I think important about this particular case is it said that this one trap law is not constitutional, but it didn't clear the way for every other ban that they try and do, whether it's on gestational age or all different ways that they try and put forward laws that impede access to care. So we need to pay close attention to all of that and keep up the fight. Celebrate this weekend and keep up the fight. Thank you.
Thank you, Jody. Candace, do you want to tell us about the task force and how we can get involved there?
Yeah, can you all hear me?
Just speak up a little bit if you would.
Okay, so if you go to our website, which is at thetaskforce.org, that's a great place to start to learn about all of the reproductive health rights and justice and intersectional LGBTQ health rights and liberation work that we're doing. And I would also really implore everyone to check out all of the amazing Black reproductive justice organizations that are doing amazing work out here. Sister Song is one of the preeminent organizations, so going to sistersong.net and/or following them on Twitter and Instagram is such a great way to get information. Here in DC, In Our Own Voice, the Black Women's Reproductive Justice Roundtable is a great resource to find out what's really happening in a lot of these key states, as well as nationally, especially for Black women. And a lot of these organizations are led by Black, queer, and trans women, which is just so important that, we're represented from, the top down. So I would really implore folks to kind of expand their network of who they're getting their information from, and looking to folks on the ground as well, looking to folks who are doing grassroots organizing. And as the Democracy Project Director at the task force, I would be remiss if I do not implore people to please fill out your census, make sure you're voting. Voting is going to look a lot different, so be patient, but this is such an important election, and we really need to make sure that we get out and vote. I feel like every time lose an election, whether it's congressional or presidential. I'm like, this is the most important. But again, here we are. This is the most important election of our lifetime. And we really need folks to get out there and vote.
Thank you so much for joining us, Candace. And Shannon, we'll let you take it home.
Okay, so you can join us. We are a membership organization, and honestly, we would be nothing without our members. So we have 270,000 members in California. We have almost 3 million members nationwide. We are 3 paid full-time staff in the state of California. So the work that we are able to do is honestly just a tribute to our incredible activists who actually help us drive our campaigns forward. So to join our membership, go to pro-choice. Oh my gosh, what's happening? I just totally blanked out. Go to prochoicecalifornia.org. And then you can also follow us on all social media by just going to @prochoiceCA. And then I want to make a plug too for just some of the intersectional work. I think not a lot of people know that the California Coalition for Reproductive Freedom is actually 40 different, more than 40 organizations who are working in the reproductive health, justice, freedom space in this state alone. And if you search for the California Coalition for Reproductive Freedom, you can look up all those organizations and check them out. California Latinas for Reproductive Justice, Black Women for Wellness, whole host of different groups. Our only abortion fund in the entire state, Access Women's Health Justice. They've been doing a fundraiser recently. They could use our help. They're providing a lot of, like transportation and housing support for people who are coming here with abortion care needs and who need them in the state. So yeah, that's my plug.
Awesome. Well, this has been a great hour. We're just shy of an hour, so I think I did a decent job of timekeeping here. I did want to just one more time thank the 3 of you for joining us tonight and for all of your advocacy. I wanted to thank again Congresswoman Judy Chu, who gave remarks earlier, and Candace also mentioned HR 1692, which is sponsored by Congresswoman Barbara Lee, who's also been a great ally to our organization, and Senator Tammy Duckworth. So just a shout out to all of the champions, whether there are elected officials or our organizations. And you'll also be able to, this is recorded and it's going to be available on Equality California's Facebook page, probably on our partner orgs pages as well. So if your friends wanted to check it out and missed it, they can go back and watch again. And I will give you back 2.5 minutes of your life this evening. But we will all, celebrate this decision, but keep up the fight and go forward. So thank you again for joining us tonight, and we'll see you soon.